Do you ever get up from sitting for hours with a bit of a stiff sore mid-back and think, I don't think my sitting posture was all that flash just then? Well, if that stiffness and soreness haunts you for days or months or even years, this is how to sort it. Hey, welcome to Body Fix Exercises. My name's Stefan, been a chiropractor for 27 years, and I'm here to help you understand, prevent and improve musculoskeletal problems. So let's do it. Stiffness and soreness in the mid-back is one of the easiest problems to help yourself. But first of all, you've got to understand it. Now, 90% of all problems in the mid-back area are caused from sitting in a poor position, slumping. Okay, now naturally, there's three curves in the spine. A curve in your neck, the bones come out more in between the shoulder blades, and then they curve in again in the low back. But when we slump, the bones in the mid-back bend much more in the flexed position, and they get stuck in that position. And that's what causes a lot of muscle tightness, stiffness and soreness in between the shoulder blades and a bit further down. It doesn't matter how many exercises you do for your mid-back. If you sit in a bad position, your problem will keep coming back. So every time you sit down, try to make sure that your pelvis is as far back as you can. Sit in a chair that has a firm backrest and a bit of an arch support. And avoid two very bad positions: sitting on a couch with your feet up all slumped, and sitting in bed, which is terrible for your back. Now, there are other causes of lower thoracic pain and stiffness. The second most common is probably a bed that's too soft or too hard. So you end up tilted one way or the other all night, which isn't all that great for the mid-back. But also referred pain from the abdominal organs. So for example, gallstones can give you pain in your mid-back. So if you do have pain that persists, make sure you go and see a professional. Now, as usual, I'll give you a shortened version at the end, and don't do any exercises that hurt. Exercise 1. Always start off with this exercise because the other exercises will be more effective after this one. You may have seen this one before in my posture video, but today I'm going to give you a variation too. Roll up a doubled up towel on a slight angle so that it's tapered at the ends and about fist size. Lay back over it so that your head is slightly lower than your mid-back, and make sure that you bend your legs. Then support your head with the tapered end of the towel or another folded up towel so that you're looking at the ceiling, not behind you when you relax. You should feel the pressure of the rolled towel in your mid-back where the spine curves out, not in the lower back where the spine curves in. If it's uncomfortable, roll the towel up a bit smaller or a bit looser. Then just lay there for a minute with your arms out. For the variation, start with your arms vertical, breathe in, then lower your arms slowly as you exhale. Repeat this 10 times. Exercise 2 is a variation of an exercise for your lower back, but designed to target the lower mid-back more. Instead of the traditional cat-cow exercise with your shoulders above your hands and the hips above the knees, we start off with our pelvis further back. This flexes the lower back a bit so that when we go down, the movement is more isolated in the mid-back or thoracic spine. Put your elbows on the floor about forearm distance from your knees and go up and down 10 times slowly. The head coming up as the body comes down and vice versa. Keep your chin down, not tilted right back as the head comes up. This exercise not only mobilizes the spine, but it also causes some reciprocal inhibition. This means that as you lift your back, you contract your abdominal muscles, and this has a reflex relaxation and loosening effect on tight mid-back muscles. Go up and down 10 times slowly, and then at the end you can add some side-to-side motion in the down position to mobilize the spinal joints further. Another variation is with your hands close to your knees. Just do whichever variation feels good for you. Exercise 3. Now let's throw in some lower mid-back rotation to make sure we get movement in every plane of motion. Start face up, drop one knee down to the floor, place one hand on top of it, then stretch the other arm back the other way. Look in the same direction as the extended arm to create a continual spiral of rotation in one direction. Relax and hold for 20 seconds, then do the other side. Exercise 4 is the mini cobra but an active version. Face down, raise your body up onto your elbows and hold it there a moment to check to see that it doesn't hurt your lower back. If the lower back feels sore in this position, skip this exercise, but if it feels good, make sure that your chin is tucked in, not up, and then gently sway the pelvis from side to side. Do this for about 20 seconds. Exercise 5 is a good one if you want to target a little bit higher up in your spine, more between the shoulder blades. And there's 3 options. With one foot forward, toes almost touching the wall, put your hands behind your head, intertwining the fingers at the base of the skull. Then slide the elbows up the wall, hold for a moment, and then slide back down. There's a nerve near the inside of the elbows, so if it feels a bit sensitive, try not to press too hard against the wall with your elbows and keep the elbows closer together. Repeat 10 times slowly. In the variations, we don't slide the elbows, we move the body instead. You can do this with the elbows on a chair or on the floor. Don't do all 3 variations, that'd be a bit too much. Just choose one that feels the best for you. Now I'm going to throw in a bonus exercise here. If you've got a foam roller, you can finish off rolling over the lower thoracics and the muscles. Lift your pelvis off the floor and roll up and down your back for 30 to 60 seconds. Make sure that you support your head with your hands at about the same level as your body and keep that chin down. There you go, done. Now I know there's a lot of thoracic extension exercises in there. That's leaning back, and that's to counteract all the forward bending we do and all the slumping. But keep that in mind and don't do too many of these exercises the first day. Maybe just do 5 instead of 10 of each of the exercises until your body gets used to it. Now if you want the quick version, I would do exercise number 1 and exercise number 2, which is the rolled up towel lying on that, and the modified cat-cow on your elbows going up and down, because they're the most effective. The best time to do these exercises is at the end of the day after you've done all your sitting. But you can do a few during your office breaks as well to keep your mid-back nice and free. But remember, the most important thing is avoiding the cause, and the cause is slumping in your chair most of the time, so be mindful of that. But that's it for today. Hope you liked the video. If you did, give it a thumbs up. Please comment, consider subscribing, and I'll see you on the next video. Cheers. The most effective. And something else. Your mid-back. No.